Good evening, all. As we are in a changing phase of teaching methods in Agada Tantra, so as the topics are also changing a little bit, we are more inclined towards making the children aware of the clinical aspect of Agada Tantra. Let us try our level best to succeed in that, so that the future generation will be much aware of the concepts, how that they can be used, how the textbook can be made effectively applicable in the clinics in the lines of Agata Tantra, because a lot of concepts are there which are very much relevant today, and they are going to be one of the most sought after concepts tomorrow, because we have a lot of concepts which will not be able to be completed maybe by 1 hour or so. So by our sincere efforts, let us keep on trying to improvise ourselves about the textbook, about the applicability of those concepts in the patients. Regarding that, let us straight away go to the discussion points. Today, what we have planned to discuss is regarding the application of treatment principles of Agata Tantra in contact dermatitis. The thing is, we have our own set of allergens or antigen antibody reaction concept in the Kalpasthana, where uh, two types of discussion can be opted in this thing, where Agada Tantra as a subject should be made reachable to the UGs, undergraduates, and these concepts are to be dealt in depth for postgraduates, for PG students also. And for we practitioners and we teachers, we can go further deeper into the aspects. But first of all, let me uh, put forth a few references that are very necessary while we consider the point number one, application of treatment principles in Agada Tantra in contact dermatitis. Here, what we can deal, what we can discuss, what we can convey to the children is the reference from Kalpasthana first chapter, shloka number 25 and 26 and 27, of course, where Acharya Sushruta deals with अन्ने पाने तंतकाष्ठे तथा अभ्यंगे अवलेखने उत्सादने कषाये च परिषेके अनुलेपने च and स्रक्षु वस्त्रेषु शय्यासु कवच आभरणेषु च पादुका पादपीठेषु पृष्ठेषु गजवाजिनां विषजुष्टेषु च अन्येषु नस्य धूम अंजनादिषु लक्षणानि प्रवक्ष्यामि चिकित्साम् अपि अनन्तरम्. So this is one of the prime area there where we have to explore regarding the influence of contact dermatitis in today's scenario, where all these like Anna, Pana, Dantakashta, all these external origin materials are sufficient enough to cause allergy to the people. Here, Anna stands a little bit different because that and Pana, of course, Anna and Pana are directly related to this. At the same time, they are very relevant in Dharavisha and also in Dushi Visha. Why I am telling this? Because when we discuss about Gara and Dushi, we will be able to understand how influential the Anna and Pana factor is there in the manifestation of such contact dermatitis in lines of Agada Tantra. So all the three concepts can be made use of, and we can teach children regarding the references. First one is this one. That's why I had requested the teachers to have textbook together with them. The reference is Kalpasthana, first chapter, 25, 26, and 27. And all the symptoms related to Anna, Visha, Pana, Dantakashta, all these are explained in the subsequent references. Next reference for the next one or two or even three pages are directly related to this shloka. How one example I will mention, very common example is footwear dermatitis. or the dermatitis which occurs due to footwear, chappals. They are irritant contact dermatitis category. Shloka number 72 and 73, where Acharya mentions Shobha Sravastata Swapaha Padayoho Spotajanmacha Bhavanti Vishadushtabhyam Padukabhyam Asamshayam, and even treatment also is mentioned. So we can convince the students that what they see in the form of ornament allergy or watch or chappal or detergent allergy or even allergy for pollens or external origin related allergies, anything and everything is covered in these 2.5 pages. Another aspect that is very relevant for understanding the contact dermatitis is in Gara and Dushi Visha that we will discuss when those shlokas are being dealt. Anna and Pana holds a very significant role here in Gara and Dushi because this is one direct reference that we get as far as Anna is related in the manifestation of Visha. For easy understanding of UG patients, UG children, one thing is very significant. This time we have got an opportunity that Charaka Purvardha at the same time Agata Tantra will be going hand in hand. And Charaka Vimanasthana, second chapter, and also Grahani Dosha Chikitsa, Charaka Chikitsa, 15th chapter can be clubbed together while dealing with Anna and Pana Gata Visha. And food poisoning also can be included in this. The first shloka of Charaka Chikitsa Sana 23 is in the present slide. Athato Vishachikitsitam Vyakyasyamaha. In that, if you see Chakrapani's commentary, Deha Sambandhi Vishasya Lingani Tatha Annadigatasya cha Lingani. Annadigatasya cha Lingani is a very significant statement for the manifestation of Dushi Visha as well as Gara Visha. Because in Sushruta and Charaka, they have not demarcated in a very clear-cut definition for Gara and Dushi. According to them, both are one and the same because while mentioning Dushi Visha, Chakrapani mentions about Garavisha, and while mentioning Garavisha, Chakrapani mentions Dushi Visha. At the same time, if we see in Sushruta's Kshara Prayoga, Sushruta Sutrasthana, while he mentions about indications of Paniya Kshara, the first indication is Gara. The first indication is Gara. And for that, Dallana mentions Gara means one type of Visha, Dushi Vishamiti Anye. A few people mention it as Dushi Visha. And also, if we see the Kalpasthana, while mentioning about Dushi Visha, the Lakshana of Dushi Visha, for example, Tenardito Bhinna Purisha Varno, Biganda Vairasya Mukha Asya Mukha Pipasi, Murchan Vaman Gadgadavak Vishanno, Shloka number 27 and 28. In that, Dallana mentions Tena Garena Ye Dosha Bhavantitan Darshayannaha. Tena Garena Ye Dosha Bhavantitan Darshayannaha. So it is very necessary where once we start teaching the children of second professional BAMS, they are easily getting confused what this Gara is, what this Dushi is, and what Viruddha is, where they have to be considered. And when we start teaching the symptoms and manifestations, all the symptoms are almost similar because Udara or skin manifestation or any systemic illness or related to infertility or related to the gastrointestinal manifestations. In all these classification of modern disorders, these all are covered in all the three contexts. May it be Viruddha. Let us go through each and every shloka. Then we will be able to understand how complicated the things are once we start convincing the UG students. But we should first convince them that all these three are related and all these three are one and the same, but only differs as far as its manifestation is concerned and its recurrence is concerned. For example, Tena, one or two examples I have already mentioned. Tena, Gara and Dushi Visha. Now coming back to this Annadigatasya Lingani terminology, you can see the direct reference of Annadikatasya Tilangani in Charaka Vimanasthana, second chapter, where he has directly linked Ahara and Ama and Visha. Ahara, if resides for a long time in the body without getting expelled, and it starts its manifestation in one way or the other, it will turn into Visha, and that Anna or Ama will turn into Visha if it stays in the body for a long time. And its manifestation will be Visha Sadrisha Lingatvat. If you see Visha Sadrisha Lingatvat, straight away, if you go to the symptoms of Dushi Visha, आमाशयस्ते कफवातरोगी पक्वाशयस्ते अनिलपित्तरोगी भवेन्नरो ध्वस्तशिरोरुहाङ्गो विलूनपक्षस्य विहङ्गः is the comparison and the placement of these annadigatasya chalingani visha sadrisha lingatvat due to anna visha. Straight away Sushruta as well as Ashtanga Hridaya Vagbhata so as Ashtanga Sangraha mentions Amashayaste Kapavata Rogi Pakvashayaste Anila Pitta Rogi and Bhavennaro Dosta Shirorohango Viluna Pakshasya Yatha Vihangaha goes directly to the acute and chronic manifestations of GIT like pancreatitis or appendicitis or a case of intersusception or a surgical emergency condition or once managed conventionally, it has got result, but it is recurring in nature. I think we come across in our clinic regarding the frequent onset of pancreatitis and the pain getting aggravated, or even cholecystitis. Uh, I am little bit deviating from the topic where we have been successfully managing the case of chronic pancreatitis or in the form of chronic calcific pancreas and even a few cases of hernia, indirect hernia. We are dealing with the Agada medicines. The pain is subsiding significantly, so that we are getting time for advising the patient to go for a detailed checkup, and also cholecystitis and cholelithiasis. All such cases are Amashayaste Kapavatarogi, Pakvashayaste Anilabitarogi. These are all related to Amavisha and Annavisha. But at times we are forgetting that medical emergency is equally important when we consider surgical emergencies, where Agada can contribute in managing a few of the symptoms which are recurring in nature. Of course, we all know these conditions are recurring in nature. So coming back to this dermatitis area, where Annadikatasya Chalingani and Annaja Visha will directly lead to Alasaka Visuchika, one side that we discussed while we just dealt about the GIT, acute clinical conditions. This is the area where we have to concentrate while we teach Nidhanasthana, Charaka, Purvarda, as well as Agadatantra, a common link between all these three, where this is the reference from Grahani Dosha Chikitsa, Charaka 15th chapter, where he mentions Ghoram in Anna Visham Chatat in the 46th shloka, which deals with the GIT acute manifestation, may it be medical or surgical. And the last line is significant for dermatitis. Rasadi Vishya Samsrishtam Kuryat Rogan Rasadijan, a case which is very chronic in nature due to the accumulation of dosha or visha in the GIT, which later can turn into any one of the dhatu gata or dhatu pradoshaja vikara. So these dhatu pradoshaja vikaras, if you see, has a direct link to Charaka Sutrasthana, where he mentions rasa pradoshaja to shukra pradoshaja vikara, where rasa, rakta, and medo conditions are directly related to the skin clinical conditions that we will see in the coming shlokas. So what we have to convince, according to me, to the students is Agada has an element of references in other chapters also. Because Gora Manna Visha is in Chikitsa Sthana 15th chapter. And am I audible? Am I audible?
Yes, sir. Yes, sir.
Yes, sir. Please continue.
And this Ghora Manna Visha in Grahani Dosha Chikitsa, and from the direct reference of Charaka Vimanasthana second chapter are one of the examples. And also very, very important thing is the the reference related to Udara. If we see Charaka Chikitsasana 13th chapter, we can see the Udara Nidana. In Udara Chikitsasana 13th chapter, if we open 13th chapter of Chikitsasana, in that I hope a few of you may be having the textbook. In that, if you see Udara Nidana, Shloka number 12, there is Atyushna Lavana Shara Vidahi Amla Garashanat, and in the third line, Liha Arsha Grahani Dosha Karshanat, Srotasam Dushanat Amat, Sankshobat Atipuranat. So all these things are directly hinting towards our reference. Our reference is directly seen in other chapters also. So let us make them a habit of reading other chapters when we are dealing with the Agada Tantra, so that it will be easy for us. By 6 months, they will be very much acquainted with the method of searching the textbook and searching the references. In this year, I have been trying to take class at least for 5 to 10 minutes to show that there are other chapters also which deal with Agada Tantra. So I take my textbook. Uh, I take my textbook to the classroom, and 5 minutes or 10 minutes I spare convincing them and showing them the reference that in Agada Tantra, if we see Dushi Visha or Garavisha, the same words are repeated in other chapters also. So one uh,
Gopikrishna sir, just 1 minute. Gopikrishna sir, sorry for interruption.
no problem.
Parmeshwar Raut sir, I have been constantly muting you. Kindly, please mute yourself. About 10 to 15 times I've already muted you, sir. I don't know, there's some problem. Every second there's an unmute from your side. It is disturbing the webinar, sir. Please mute yourself. Extremely sorry, Gopikrishna sir. Kindly continue.
Okay. It becomes our duty to convince the children. I hope I will be able to contribute a few more inputs regarding the references in other chapters related to Visha Chikitsa. I have been constantly working for the past 10 to 12 years regarding how many Agada references, clinical references, and theoretical references are seen in other chapters in Charaka and Sushruta. Ashtanga Hridaya, I am started working nowadays, so that I will be able to contribute to my level best to my fellow teachers regarding the references in other chapters directly related to Agada. One such reference is this one in Chikitsasthana 13th chapter, Sloka number 12. We can directly get the name Garavisha. In such conditions also, in Udara, we can get that reference, and we have a clinical case. In the name of Budd-Chiari syndrome, where the patient was thinking that he had psoriasis. The patient was thinking that he had psoriasis because psoriasis was the presentation, and he also had raised IgE levels also. So there was a small misdiagnosis from the side of other practitioners, some other place. But what we had thought was we better refer to that patient because we found borderline ascites. At the same time, there were engorged veins on the thorax, and also he had icterus. We got his LFT and lipid profile and RFT done. Then we came to know some other serious pathology related to liver was there because he had hepatomegaly also. So once he was referred, he was diagnosed to have Budd-Chiari syndrome, and then later he came back to us, and we had successfully treated in the lines of Garavisha itself. So that was a big message for our children a few years before, where those batches are now also in contact, that they are started to consider the reference related to Gara and Dushi once they have started practicing. So this is what way we can contribute, that other chapters also have reference in the lines of Prapti, or even complication, or even in the lines of complications, where we can get direct reference of Agadatantra. So another reference related to the dermatology manifestation is Garavisha. This is Garasamyogajam Chanyat Garasamjam Gadapradam Kalantara Vipakitvat Natadashu Haratyasun. If we see this reference, we can see Kalantara Vipakitvat, or whatever the Chakrapani commentaries mentioned. It is very, very true. But our striking observation should go towards that maroon line. Dushi Vishamagre Vakshanti Tat Trividha Antargatam Darshaishyamaha. See, in the context of Garavisha, Dushi Visha is going to be explained, which means there is a direct relationship between Dushi Visha and Garavisha, where it means if it is exposure for the first time due to an external allergen, which is mentioned in Sushruta, Kalpasthana first chapter, which we discussed, Annepane Dantakashte Tata Abhyanga Valekane, it can later manifest repeated manifestations. Out of that, one factor can be due to this Dushivisha manifestation related to irritant contact dermatitis. Because we all know how the pathology of irritant contact dermatitis works out, or even allergic contact dermatitis, where those mast cells or histamine, once released, will be having an imprint in the brain in the form of memory cells, which later leads to the repeated manifestation of the same symptoms once that exposure is repeated. It is exactly Dushivisha presentation, where these memory cells and those histamine release when that allergen is exposed again and again in a patient is what Dushivisha is mentioned. And if we see one more interesting thing is mentioned, where we can teach children that Nirvisha Dravya Samyoga Krita and Savisha Dravya Samyoga Krita is a minute classification for Garavisha. We better convince the students that Garavisha should be used in another terminology in the form of Samyoga Javisha, so that they will be able to classify the clinical presentations very easily. Because I have started deliberately putting into the children's mind that Garavisha should be better called as Samyoga Javisha, because Samyoga Javisha can be divided into two, Gara and Kritrima. Samyoga Javisha can be classified into two, Gara and Kritrima. That's what Kashyapa as well as Chakrapani has evidently mentioned. See, Nirvisha Dravya Samyoga Krita and Savisha Dravya Samyoga Krita. Tatra Adyam Garasamjnakam. See, Garasamjna is Nirvisha Dravya Samyoga Krita, and this is directly related to Viruddha. Charaka Sutrasthana 26, if we see all the combinations, all the 18 types of Viruddha are actually Nirvisha. They are totally harmless. Once they are combined in a specific pattern, or processed in a specific pattern, or taken in a specific duration in a specific period, that can lead to a disorder. And these disorders are due to Nirvisha Dravya Samyoga Krita itself. So what I mean to say is, if we classify the Samyoga Javisha into Nirvisha Dravya Samyoga Krita, it will be easy for us to convey that this term mentioned in the context of Gara directly related to Charaka Sutrasthana 26th chapter, while mentioning about Viruddhahara, it is one and the same. If we see the next category, Savisha Dravya Samyoga Krita. Savisha Dravya Samyoga Krita is a very much beautifully coined term once we consider the involvement of adverse drug reactions, ADRs. See, Savisha Dravya Samyoga is a combination which is prepared out of a toxic substance itself. What we can see in our routine practice, in our clinics, is it has a direct relation to Charaka Sutrasthana first chapter. Charaka Sutrasthana first chapter, we get a reference. I will show this now itself. This one. See, Yatha Visham, Yatha Shastram, Yatha Agnihi, Ashanir Tatha Aushadam, Avijnatam, Vijnatam, Amritam Yatha. For this, Chakrapani has very beautifully mentioned that a drug can act very much adversely if it is prescribed in a wrong manner, or it is combined in a wrong manner. We can see a lot of ADRs in our clinics now. I can show you 2 or 3 cases of adverse drug reactions. This is one such. This was Bhallataka toxicity. We have a cross reference for this also that I will tell. Bhallataka toxicity. See, Bhallataka toxicity, once we consider, we have to consider two reference where one straight away a wrong combination. This was due to Bhallataka rasayana. A patient who he was a case of psoriasis where we had managed psoriasis effectively. First day of Bhallataka rasayana was perfectly okay. Second day was also okay. On the third day, he started rashes. So it was due to an adverse drug reaction where the patient developed Bhallataka toxicity. Now we can show to the children that this reference is very relevant. Kinchicha, spotadikan kritva. See, the second line underlined, blue underline, I have put 1, 2, 3, and fourth line. Kinchicha, agnivat, spotadikan kritva marayati. This is spotadikan kritva. She took a 2 course of steroid. At the same time, she had NSAID, where the patient came to know that she had pemphigus vulgaris. This is a case of pemphigus. Second case, where an injudicious prescription of medicine can lead to a dermatological condition or a case of acute emergency. This is the third case. See, this is the third case. He had taken steroid for 2 years without medical consultation. Proper medical consultation of was not taken, and he was taking a low dose steroid for 2 years. His IgE level is more than 10,000 or somewhere. He is admitted in our hospital now. We are treating him for the past 1 month, and we are making our blood and brain together. We're not even able to control the lesion. But nowadays, the last photo is what he is on November 10th. After 3 weeks of uh, uh, effort, untiresome effort daily, we have been observing him for the past 24 hours every day. What are all the symptoms? He has fever, he has gastritis, he has vomiting, he has skin lesion. See how a presentation of Dushi Visha can arise. Amashayaste, Kaphavata Rogi, Pakvashayaste, Anilapitta Rogi. This is a case of dermatitis. So a case of dermatitis is also relevant while we discuss about Dushi Visha, and also the reference in Charaka Sutrasthana first chapter. So what this reference I have been teaching for children for the past 15 years, where Agada is directly mentioned in first chapter of Sutrasthana in Charaka Samhita itself in the form of adverse drug reaction, that too a reference which is directly mentioned by Chakrapani in this shloka. See, in this shloka, Savisha Dravya Samyoga Krita, a faulty combination of medicine is Visha itself. That's why Gara be better called as Samyoga Visha, so that they will understand easily how we can interpret an adverse drug reaction or a medicine prescribed in a wrong way, and also Nirvisha Dravya Samyoga Krita can directly be correlated to Charaka Sutrasthana 26th chapter to the context of Viruddha. See, this is the presentation that I have been telling. Tena Pandu. This is a reference from Ashtanga Hridaya while dealing with the Garavisha. And this Garavisha, Tena Pandu, Krisha, Alpagni, Tasa Shwasa Jvaraditaha, Vayuna Pratilomina, all these features were very evident in that Bhattacharya case. All these symptoms, whatever symptoms are mentioned in the first 4 lines, were there in that Bhattacharya syndrome. And we can show 9 clinical presentations related to autoimmune disorders in this 4 shloka. But as our topic is regarding contact dermatitis, I just mentioned the case of Bhattacharya syndrome, where skin was a presentation, sudden manifestation of skin was the presentation, but actually it was a condition related to autoimmunity, where we have really shown in the OP, in the clinics regarding 9, including Addison's disease. There is Addison's disease also in this clinical condition. In some other condition, some other day of discussion, we will be able to discuss how an autoimmunity condition like Addison's disease or even celiac disorders related to IBD are related to this condition. At the same time, going directly towards Grahani Dosha Chikitsa. This was the reference that I was mentioning while discussing about Amashyaste Kapavata Rogi condition. Here also, a repeated manifestation of skin disease will be seen. Even though we have not direct reference for a dermatological condition, there is a phrase mentioned in Sthitam Rasadishvatava Vichitran Karoti Dhatu Prabhavan Vikaran. Now, where we have to bring a link to the skin disorder, to the GIT, to Dushi Visha is the same line is mentioned in Grahani Dosha Chikitsa. See, Sthitam Rasadishvatava Vichitran Karoti Dhatu Prabhavan Vikaran. If I show you directly, straight away, see, last line mentioned in Grahani Dosha Chikitsa, Rasadi Visha Samsrishtan Kuryat Rogan Rasadijan, and in Dushi Visha also, Taraka as well as Sushruta are mentioning the same thing. Rasadi Shvatva Vichitran. Once that Visha enters into the Rasadhatu, various manifestations can develop. Skin is one among them. And repeated manifestation of skin is again to be highlighted. Rasadishu Jastitam, Nana Vidhan, Dhatu Prabhavan Vikaran, Karoti. They are directly going to the manifestations related to skin or joint or a condition related to autoimmunity. Even there are a few conditions related to hematological malignancies. That also we have correlated with the manifestation. Hematological manifestations related to malignancy condition also relevant in this reference. And this is again another reference for allergic dermatitis. Manifestation of dermatitis condition is kotha. If you see the last part of the shloka, first line, kotha is one of the words mentioned for dermatological condition, that to acute manifestation or repeated manifestation of a clinical condition. Say in one word we can mention acute on chronic manifestation. Dushi Visham tu, Shonita Dushti, Aruhu, Kitibha, Kotalingam cha. This reference is related to Dushi Visha and its method of manifestation in a person. It can be seen in the lines of Lingam cha is it can be seen with the symptom complex or symptoms of Shonita Dushti, symptoms of Aruhu, Aruhu is Vrana. Kitibha is a representative of gradual manifestation of a skin disorder, and Kotha is a representative of sudden onset of skin disorder. See how beautifully in one line he has explained the manifestation of dermatological conditions in Doshi Visha. Shonita Dushti is one presentation, and this directly goes to Charaka Sutrasthana 24 Vidishoniti Adhyaya. If you see Vidishoniti Adhyaya, see, this is the manifestation. Shonita Dushti, one word is equivalent to 12 lines in Charaka, in Sutrasthana 24. He has concised into single terminology for Dushi Visha, where one of the Nidana is Dushi Visha. You can see all Annaja related condition which are mentioned in Grahani Dosha Chikitsa. If we see Grahani Dosha Chikitsa, all these are seen. Viruddha Nam, Upaklinna, Puti Nam is the word he has used for the accumulated ama which later turns into Visha, and such Visha Anna or ama is Suktanam and Viruddhanam Upaklinna Putinam. Puti is which is there in the body for a long time and got into Puti Avastha, decomposed Avastha. And if you see, Vega Vidharana is also one of the factors. There we have another dermatology manifestation that we will discuss. See first, this one. Itibha Kotalingam Cha. If you see here, in this manifestation of Charaka Sutrasthana 24, last but one line has a word called Kota. I hope you are able to see the slide. The last but one line, you will get Kota. See, Kota is there. And one more manifestation is Pushta Charmadaladayaha. Pushta Charmadaladayaha is again relevant for Dushi Vishamtu, Shonit Dushti, Aruhu, Kitibha, a disease which is long standing. That's why I told in the first initial phase of presentation itself, we should not demarcate or bifurcate between Dushi Visha and Garavisha or Viruddhahara, because in one way or the other, they are all related. They are all related, but its manifestation and its periodicity and its chronicity and its repetition in nature decides where we have to place that particular condition. Even Chikitsa is not different. Chikitsa is also mentioned in the same way. Chikitsa Sutra is also in the same way, but medicine changes. Only change is seen in the form of medicines. So if we see again here, one vague underline I have put, Vishaha, Kita, Hina Virya Vishaha, Vaktavyaha. In Dushi Visha, deliberately, Charaka has put Vishaha, Kita, Hina Virya Visha, Vaktavyaha. How Dushi Visha and Kita Visha are brought into same under the same umbrella is this reference. Dushi Vishaha, Kita, Hina Virya Vishaha, Vaktavyaha. I hope you have observed that in a few Jangama Visha, there is a classification of Pranahara and Dushi Visha pattern. Pranahara and Dushi Visha pattern. That Dushi Vishaja Kita or Dushi Vishaja pattern of Vrishchika manifestation, it exactly resembles a repeated presentation. Why I am telling this? Because another significant and striking reference is in the context of Vishamukta Lakshana reference. If we see Sushruta Samhita, in Sushruta Samhita, we can see the last line of 5th chapter. Sorry, this one here. Last line of 6th chapter. Last line of 6th chapter. Dundubiswaniya, where Dallana has very much supported this opinion. Dushi Vishaha, Kita, Hina Virya Visha, Vaktavyaha. And that shloka, unfortunately, is for Vishamukta Lakshana. And it is our duty to convince the children that Vishamukta Lakshana is only relevant for Sarpa Visha. Why? Because I will read out that reference. Idam Savisha Avisha Lakshanam Tikshna Tama Stavara Vishe Sarpadashtecha Drashtavyam. The Vishamukta Lakshana is applicable for Tikshna Tama Visha like Stavara Visha or Sarpadashte, Sarpa Visha. Natu Manda Vishe Chirena Dhatu Dushana Kare Mushika Vishe Kita Vishe Shucha. That is, it is the duty of a physician to make sure that he should not assess the Vishamukta Lakshana in the cases of Manda Visha, Chirena Dhatu Dushanakara Visha, Mushika Visha, and Kita Visha. That is because they are definitely going to cause trouble on and off in a patient if he falls or if he fails to follow the proper pathya for a significant duration. See, there is a lot of link in between Charaka's this opinion and Sushruta's opinion, that too particularly for Vishamukta Lakshana. In the context of Vishamukta Lakshana, if he had an insight that definitely it is going to recur. That's why Dushi Visha and Kita Visha Lakshana and Manda Visha Lakshana and Mushika Visha have directly linked towards Dushi Visha because they are going to recur. And we have to manage it accordingly. If we start interpreting the textbook in this way, we can definitely show in the patients of other clinical conditions also that memory cells, release of histamines, in a case of atopic dermatitis, raised IgE level, getting down, repeated investigation once in 6 months or so, we can show IgE levels coming down. And once the patient starts apatya, again it will go up. That's why Visha Mukta Lakshana, Kita Visha are very relevant. And one more significant reference is Kita Visha has been deliberately added by Sushruta in the context of, Garavisha has been added deliberately in the context of Kita Visha. If you see Kalpasthana 8th chapter, we can see the definition of Kita Visha. We can see the definition of Kita Visha in the shloka number 24. Yogaihi nanavidaihi esham churnani garamadishet dushi visha prakaranam tathacha api anulepanat. It has a very significant commentary. As the time is not permitting for me to read this, I am not reading it out. if we go through the commentary, we can directly go towards cantharide poisoning. Cantharide poisoning where Kita Deha Churnanam Nana Aushada Yogat Tatha Anulepanat Api Garatvam Aha Yogaihi Ityadi. This is a very, very significant reference for children to teach that the repeated manifestations are due to the exposure to a toxins constantly, and also we can equate these reference to pollution also related to occupational toxicity, or regarding the pollution, regarding the upper respiratory infections, regarding recurrent lower respiratory infections, and the relation between recurrent upper or lower respiratory infections to the manifestations of skin in the form of atopy. All these are related to Dushi Visha. So two questions we have already discussed. Application of treatment principles of Agada Tantra in contact dermatitis. All these areas of Kita Visha, and the reference which we have been discussing for the past past 35 minutes. Dermatological conditions caused due to Gara and Dushi Visha that we have been discussing, and I will go a little bit deeper into this reference. Dushi Visham tu Shonita Dushti Aruhu Kitibha Kotalingam cha. Shonita Dushti we already discussed that Charaka Sutrasthana 24th chapter, and Rakta Pradoshaja Vikara, which is mentioned by in the context of Dhatu Pradoshaja Vikara in Charaka Sutrasthana 28 are to be brought together so that we can bring these cross reference while teaching the Dushi Visham to Shonita Dushti. Aruhu is a wonderful combination for Shalya Tantra and Agada Tantra. Aruhu, if we see, I carry Shabdakalpadruma reference also, because Aruhu is an armory for us to treat joint disorders and musculoskeletal system. Why? Because musculoskeletal system is one of the clinical conditions which are long-standing, and also marma asti sandayaha is one of Vyadhi Marga, one of the Vyadhi Margas in Nidhanasthana Charaka. If we see Aruhu, Shabdakalpadruma has two meaning. One is marma sandhigata. Aruhu is marma sandhigata, where Agada Tantra has an opinion for the manifestation of joint disorders as well as marma disorders. And we can get a cross reference in Grahani also, that we are not discussing today. We will just see another meaning for Aruhu. Aruhu is Vrana. Next meaning is Vrana. Aruhu is Vrana as well as Marma and Sandhigatatva. So Sandhigatatva we will leave for now. Aruhu is Vrana, and Vrana Chikitsa in Sushruta Chikitsasana first chapter we can see Shashti Rupakrama. Out of this Shashti Rupakrama, one is Vishagna. If we see that context, Vishagna in Sushruta Chikitsasana first chapter in the context of Shashti Rupakrama, one terminology called one terminology called Vishagna. If you see for that Vishagna, Sushruta has mentioned that will be detailed in Kalpasthana. So Kalpasthana has been dedicated just on the basis of Sushruta's assurance that Vishachikitsa is invariably seen under the umbrella of Shalyatantra. I am not telling that we are below somebody or under some other specialization. We have an authority to treat prana. That's what I have conceived a meaning from that shloka. We are authorized people to consider prana chikitsa, and we are effectively in our hospital trying to manage the prana cases also in the lines of exclusive Visha chikitsa. Because I will show you a few photographs. See, this is a case of fracture and skin grafting was done, and we had treated exclusively in the lines of Ranachikitsa, and almost the lesion is healed. For the first time in 3 or 4 years for that boy, he has found this result. Later Jalauka was done, treatment was completed. This is again another case of Pravriddha Amavata, Marma Sandhigata, Aruhu was literally materialized in this patient because she was a case of RA positive with RA level 112, C-reactive protein more than 100, and also she had all the features of RA with the Vrana. So we showed our UG and PG students that this is what Shabdakalpadruma if it lands on a patient. Both Marma Sandhi is there as well as Vrana is there for that Aruhu. See, both the clinical conditions were managed in Visha Chikitsa only. No lesion were there except for this hypopigmented patches. This is again a case of Sarpavisha, Damsha, cobra bite. Cobra bite ulcer was that. We did not manage cobra bite. He was treated in some other hospital, and because of that non-healing ulcer, they referred the patient, and he came to our OP. We made him to be in the hospital. Admission was suggested, and we treated in the lines of Aruhu for that Dushi Visha case. Kitibha, Dushi Vishamtu, Shonita Dushti, Aruhu, Kitiba. Varied presentation of skin disorder, which were considered as Kitiba because it took a lot of time to manifest. It took a lot of time residing in the body, and Dushi Visha treatment was opted, and this was the result. See, again, another method of another mode of presentation, pustular psoriasis. It was recurrent, and we had documented it. All these cases have been published also in journals. See, pustular psoriasis. This is entirely different presentation, but all related to pesticides. This boy is a farmer's son, and he resides near a paddy field. Fertilizer is used. We had just asked him to get away from that place and done Dushivisha treatment. Again, a person who had constant exposure to a few food as well as rubber field, rubber estate. Again, this is from Vatarakta perspective that we will go through in another context. And these are the textbook reference that we can bring. See, this is again another presentation. Shonita Dushti, Vidhi Shonitiya Samprapti. This line, last but one line, all these were there in this boy, in this man. See that one. Kandu This Kandu was there. Aruhu, Vrana was there. Kota, sudden onset. Pidaka, you had seen. Kushta, it was for a long time. Charmadala, exfoliation was also there. And exfoliation is characteristic feature of erythrodermal psoriasis, where Charmadala feature is seen. So we have a lot of references in other chapters related to Visha. And also if we see Punaravartakatva, Punaravartaka Jwara, why Dushi Visha recurs, why Dushi Visha is seen again and again is this one. If you see the shloka number 34, we can see the Nidana for Dushi Visha. Swalpena api apacharena tasya vyavartate punaha chirakala pariklishtam durbalam hina tejasam. Isn't this a direct reference for Dushi Visha in Jwara chapter? Only difference is the presentation is Jwara, and that Jwara is mainly due to autoimmunity. And every autoimmune condition tends to recur in a particular season or when there is slightest of apatya done in the patient. So it's all directly related to Charaka Vimanasana second chapter. Amavisha, Goram Annavisha is a surgical emergency, but Amavisha is an open window or opened door for the manifestation of Dushi Visha. So all these references bring our thoughts to one side where we have cases, we have patients, maybe in other OPDs, but it is our duty to interpret it in the lines of Dushi Visha, and we have plenty of options for us to treat in the form of medicines. Very simple medicines are there in our armory, in Charaka itself, or even in Ashtanga Hridaya, or in Prayoga Samuchaya, which is a Malayalam textbook for Visha Chikitsa, or Visha Vaidya Josnika. That is also a Malayalam textbook for Visha Chikitsa. If there is translation English translation for Vishavati Josnika, and also Prayoga Samuchayam. A few attempts have already been begun to translate into English. Let us hope if everything works out fine, all will get the benefit of the translated version. And see, eva manye picha gadaha vyavartante punargataha. Once a disease is gone, eva manye picha gadaha. There are innumerable disorders which will again on and off trouble the patient as per the season and as per apatya. So these are all directly related to Visha. Again, in Viruddhahara, we try to bring Viruddhahara with examples, but let us see that Viruddhahara, instead of quoting with examples, we have plenty of reference in the textbook. This reference is from Ashtanga Hridaya, Sutrasthana. While mentioning about Viruddha, he has mentioned Vyadhi Mrityu Hetava Ityarthaha, Vishavaccha Mrityum. All these are complications. But many of us forget that a case of Viruddhahara, where we mentioned Avishad Dravya Samyoga is Viruddha. The third line of commentary, Garavat Kalantara Nashakatvat Rogajanakatvat Cha Upamana Dvayamuktam. Viruddha is fast or slow in its manifestation. When it is slow, it will be forming or it will be manifesting like Gara. Garavat Kalantara Nashakatvat. Isn't that Avishadravya Samyoga Krita? Gara is the same word used here. Garavat Kalantara Nashakatvat. Rogajanakatvat. And it won't cause any death. Apranahara is one word which is used in other context when it is manifesting in a chronic nature. See, this is the reference of Viruddha. See, Ama Vishasya Chaiva is again used in Charaka Sutra Sthana 26th chapter. This is what we are seeing in this slide. Shandya, infertility. Visarpa, a disease related to skin which is spreading in nature. Even the slightest of apachara in the form of food, this condition can recur according to Charaka Sutra Sthana Viruddha reference, this shloka. Garavat, Kalantara, Nashakatvat, Rogam Aprana, Visarpa, Dakodarana, Vispotaka, Unmada, Bagan Unmada. I think we have a lot of reference to be discussed to bring it under Agada. Unmada, Bagandaranam, Murcha Madadmana Galagrahanam, Pandwamaya, Amavishasya Jaiva, Kilasa, Kushta, Grahani Gadanam. Isn't these the references that we have discussed in the symptoms of Dushi Visha and Garavisha? Shotha, Amlapitta, Jwara, Penasa, upper respiratory infections due to food, recurrent. That also we have an opinion where Amavisha, which is residing in the body, will lead to Penasa in Navegan Dharaniya Adhyaya also. Chakrata Pindikodveshta, there is in Vegadharana, we have Venus. I will tell because of these references, I am not able to recollect very fast. Time is about to be finished. Shota Amlapita Jwara Pinasanam. Santana dosha tathaiva mrityoho. Santana dosha is for hereditary disorders. If Shandhya was for primary or secondary infertility cases, Santana dosha represents hereditary disorders where we quote endosulfan as an example. Endosulfan in Kasaragod that talks with Santana doshasya tathaiva mrityoho viruddhavannam pravadanti hetum. This is reference from Charaka Sutra Sthana 26, where we can directly correlate with Avishadravya Samyoga Krita of Garavisha. And if we come to the treatment, the last question was regarding treatment. First, diagnosis and application of treatment principles of Kita Visha. That I already told. Dushi Visha and Kita Visha are one and the same in their manifestation and principles. That I already covered with those 4 references. Applications of principles of treatment of Gara and Dushi in the management of dermatological manifestation. Third point. See, I have put all the 3 treatments of Gara, Dushi and Viruddha. This is treatment for Viruddha. Viruddhashanajan rogan pratihanti virechanam Vamanam shamanam chaiva purvam va hita sevana. So first patyahara sevana should be made to follow by the patient. And then pratihanti, virechana, vamana and shamana. So shodhana karma is there. That too urdhva and other shodhana is there. Shamana aushadhi is required. Rasayana is required. At the same time, purvam va hita sevana.
एक तो ये चाहिए अपना ब्लड चाहिए था.
And if we see the treatment of Dushi Vishartam, Suswinnam, Urdhvamcha, Adascha Shodhitam, Vamanam, and Virechana is mentioned in Viruddha. Again in Gara, we see Dushi Vishari Magadaha, Lehayet, Madhunaplutam. Dushi Vishari Agada is a Rasayana here. So, Vamana, Virechana, and Rasayana is also mentioned in Dushi Visha. If we come to Gara, again see, Garartho, Vantavan, Bhuktva, Tatpatyam Pana Bhojanam, Shuddha Hrit Shilayet. So, Shodhana Karma is there, Pathya Sevana is there, Rasayana Sevana is there. Isn't the treatment mentioned for all these three disorders one and the same? In short, they are all one and the same. No new treatment has been mentioned for this. Our area of interest is how different we can be while managing with specific medicines. Medicines are the trump card in our treatment in all these conditions. So, Lakshanas we saw, the method of manifestations we saw, treatment also we are seeing now. All these are mentioning one and the same. And Shodhana Karma, we want to discuss. We can see a few cases. These are all relevant to Avishadravya Samyoga Krita. This is Savishadravya Krita, not Samyoga, Balataka, toxicity. One thing I forgot to tell, one of the chapters should be convinced to the children. That is Charaka Sutrasthana 18th chapter. That is Shodha, where Agantuja Shodha and Nija Shodha are very beautifully explained in that chapter. In Agantuja Shodha, Allataka is one of the words that is specifically mentioned in the manifestation of Agantuja Shodha. So, no Vishachikitsa can be taught right from the beginning without covering the Shodha. So, for what I had done for this batch was I took half an hour Shodha so that they can be very familiar what they are going to learn in Charaka Purvarda. But for me, I was very much compelled to show them that there is a context of Visha in Shodha because Shodha is an inevitable feature in Visha. May it be Savisha or Avishadravya Samyoga, there is a manifestation of Shodha in each and every toxicological condition, Visha Chikitsa. So it should begin with Shodha. That's why Charaka Sutrasthana 18th chapter is very important for us to teach children. So better, if not not dealt till now, my request is just show them the reference of Agantuja Shodha and Nija Shodha and its manifestation. If so, 4th shloka, 18th chapter, 4th shloka, Sutrasthana of course, not Shodha Chikitsa, Shodha in Sutrasthana, 18th chapter, 4th shloka. Oh, just 2 minutes, I am about to finish. 18th chapter, I will read that shloka if at all anyone is not having a textbook. Got. In that, if you see, Tatra, Agantavaha, Chedana, Bhedana, Kshanana, Bhanjana, Pichana, Utpeshana, all these are there. If you see, second line, last part, Bhallataka Pushpa Bhala Rasa Atma Gupta Bhallataka. That's where the beauty of the textbook is made evident. What I try to do is take the textbook to the class with the syllabus. If we start telling them these references, they will develop interest to explore the textbook. So that added advantage is there for children where they can see a lot of references related to Agada, and also they can be convinced by themselves by seeing the references And once we start showing the patients in our OP or showing the case photos, at least they will be that will be concreted in their mind that Agada is necessary in future also. Agada is very much necessary for their practice also. So these concepts are very much necessary for their practice and medicines in their future life. So this is one reference from Charaka Sutras and 18th chapter. One more reference is there where shloka number 6 in that 5th line. Pushta Kandu Pidaka Adibirua in Nijashota. In Nijashota, Pushta, Kandu and Pidaka. These dermatological presentations are also seen while we discuss about Shobha. So Shotha is a very important chapter to begin with. That's why let us show them that in Shotha there is a component of Visha in it. Garavisha, Savisha Dravya Samyoga Krita, Garavisha due to drug, Savisha Dravya Samyoga Krita, Shonita Dushti in Dushi Visha, Aruhu in Dushi Visha, Kitibha in Dushi Visha, and Vatarakta. And this is Kota. This Vatarakta I had put because Tvak Tamra Tateshyate is line mentioned in Vatarakta, that Bahya Tvak appearing Tamra in nature with mild joint pain, where Rakta is outside and Vata, Anyonya Avarana concept, that Avarana is directly related to the manifestation of Dushi Visha in Kapaja Vatarakta. Kapadika Vatarakta is one of the presentations where Dushi Visha treatment is relevant. Why? Because that is again another big topic where many of us are already familiar that the pain pattern of Vatarakta is like Aku Visha. Like Aku Visha. Mushika Visha pain is equal to Vatarakta pain. And Mushika Visha, I already showed that in the Visha Mukta Lakshana in Dundubiswani Adhyaya, Mushika Visha is specifically mentioned that its manifestation is similar to Dushi Visha. And if we see Kapadika Vatarakta, its management is effective when we treat in the lines of Mushika Visha or Dushi Visha. Classical example is Karanja. Nimba Karanja, that combination is there. We won't deal with medicines today, but the pain pattern. This one we can show to the children. The presentation, Tvak Bahya, Tamra, Tatesha, the color of the lesion. It may be a case of psoriasis to many of the modern diagnosis, but for us, if there is a joint pain, if skin is predominant, Rakta is involved, Tvak in the Bahya, Tamra, and it is recurring, it is Kapa Pradhana or Kapadika Vatarakta, bar Dushi Visha, bar Mushika Visha, presentation. Diagnosis is not Mujum, but presentation is because of Dallana commentary, chapter number 6, last shloka. This is Kota. Dushi Visham to Shonita Dushti, Aruhu, Kitibha, Kota. Here, Shopha is there, Jwara is there, element of Dushi Visha, that too Kota is there. This after treatment, before treatment, this I because of I had taken it from other presentation. All these photos are there. See, Ashu. This is Ashu presentation. Anti Yoga Vashena Ashu. Chirat. Chiratarat. How a Dushi Visha can act, how a Gara Visha can act, how Anti Yoga Vashena Ashu. One day, Samprapti, one day, he had gone to the paddy field, he had put fertilizer, he had cleaned the paddy field. That evening, this lesion developed. Ashu. Managed. Chira. Footwear dermatitis. Sushruta Kalpasthana, first chapter. Paduka Visha. Paduka Visha. A little bit more damaged case. Chiratara, Budd-Chiari syndrome. Late manifestations. Splenomegaly, hepatomegaly, borderline ascites, anemia, and LFT, SGOTPT more than 500. All these reports were seen. Once we started the treatment in the lines of Gara, Bar, Dushi, Visha, whole lesion was cleared. So what we have to tell children in the first class while beginning the class, or at least now, is we have our avenues in Hridaya Varna to show that there is something related to preventive cardiology. Samyogaja Visha or Gara Visha or Dushi Visha is drug interaction or adverse drug reactions. Dushi Visha are very relevant in the drug resistant conditions. Viruddhahara has its role in acute GIT manifestation and NCDs, and Garavisha and Viruddhahara in genetic disorders and food poisoning. These are all, what to say, a thing that we have to put into the mind of the students. We should keep on putting them into their mind. We have to feed them constantly that there are references related to Visha in a lot of chapters. So our duty is to just to show them that in Jwara we have Dushi Visha, in Visarpa we have Dushi Visha, in Madatya we have Garavisha, all these references. And I think if we see one interesting reference in Unmada Chikitsa, in Chikitsa Sthana 9th chapter, 4th shloka, if we see the Nidana for Unmada, Chakrapani has mentioned the word Gara in that. So why can't we show that in the lines of Garavisha, there is management for this Unmada? Because in Ashtanga Hridaya, if we see, there are 8 lines for Garavisha Lakshana. First 4 are related to body. First 4 are related to body, and the next 4 are related to mind. So equal importance for showing that the symptoms, if mentioned by Ashtanga Hridaya, are 8 lines. 4 was body related and 4 was mind related. Judicious, balanced in explanation also. That's why I told our duty is to convince the students. Our duty is to convince the students. So that's all. Organizers, please.
Thank you, respected sir. You have uh, gathered all the scattered reference of Agat Tantra, and you have taught us today how differently we can read Agat Tantra from different chapters. And once again, thank you, sir. Sir, I have a little one question from my side actually. Sir, actually, you mentioned Dushi Aru in Dushi Visha as a Vrana. So I'm treating a patient of a case of Dushtavrana, pyoderma gangrenosum. So till now I have given her only Trayantyadi Kashayam. Even some Rashoshadi also I tried, but still I'm not able to manage that Vrana has not spreaded. But I was not able to heal that Vrana. That small spot will be there again and again. That Vrana is recurring. So what treatment I can prescribe, sir? That is my doubt, sir.
Sir, in such conditions, we need a Shodhan actually. By simple Shamana procedures, many times we won't get the result. Why I'm telling this? Because once we start treating in the lines of Visha Chikitsa, we can see that without Shodhana, many things are not possible. That Visha element is there. I try to teach Dashaguna of Visha by telling the cases. One example I will tell. See, the रौक्ष्याद्वातमश इत्यात् पित्तं सौक्ष्म्यादसृक् प्रकोपयति कफम् अव्यक्तरसत्वात् अन्नरसांशानुवर्तते शीघ्रं व्यवायी भावात् आशु व्याप्नोति केवलं. That reference from Charaka or from Sushruta also. Sushruta was more clinical and more observing while mentioning those 10 gunas. If you see those 10 gunas, those durupakramatva or the method of reachability of medicines to the body so that all the dhatus will be cleared, because we are treating the ojas. Once we find an involvement of visha in a clinical condition, we are preserving the ojas or trying to recover the ojas which is being dushita. And if we see Charaka Sutrasthana 16th chapter, while dealing with this Shodhana Prakriya for Gara, Dushi and Viruddha, that 16th chapter, we have an indication for Shodhana Karma. An indication for Shodhana Karma. If we see that shloka, we have one word. Actually, I tell or I take class once all these portions are over to the children, where these are all interesting reference, because if now it's never for another person to convince that Panchakarma reference is also relevant for Agada, where he tells one line who are fit for Shodhana Karma. That he tells Balavarna Pranashascha Tripyato Brahmanai Rapi is one line. 16th chapter, 15th shloka. 16th. That element is for Ojas. We are absolutely trying to preserve that. Balavarna Pranashascha. If we see in a chronic case, the patient will be in that line. So we can manage such Aruhu by doing the Shodhana Karma first. The patient may not be in a position to undergo Vamana and Virechana altogether. But one medicine which has a Deepana, Pachana, Anulomana and Vishaharatva in nature to be added in the prescription while we are managing those ulcerations, or while we are managing the case with the which are advised for amputation or advised for this reconstruction like plastic surgeries. We can have the confidence of the patient by just tell them that we have an option for that. Let us try with that, and then we can see the difference. Many of us are getting the difference. Of course, not all the cases. I lost one case because it was a hopeless case left by almost 3 or 4 medical colleges, including CMC Vellore. But I accepted the challenge, but I could not save him. He passed away 2 months before. There are clinical conditions, but one thing is we have to convince. We have to convince the patient proper shodhana and a proper rasayana together with our shamanaushadhi or managing the main course of illness. Both should be gone together. 7 or 8 ulcer cases which were actually dropped out from other hospitals. Only what to say, our confidence in the concept of Agada is making us take these cases. And we lost only one, but we could save 8 or 9 cases which were suggested for amputations and all. So children can see all these, and they can open the context of Agada textbook, and then they come to us. Now, sir, what can we do for these cases? So these are all the contributions that we can give, sir. So Shodhana should go together. Without Shodhana, we cannot prefer a Shamanaushadhi or only ulcer management. But
Yes.
forget about that recorrection of that lost ojas.
Sir, few scholars says that in Dushish Chikitsa that Shodhana can be done directly without any snehana because Swisvinna word is mentioned. So they say they just give Svedana and do Virechana. So is it right, sir? Some of the scholar I met and they told that there is no need of that proper Shodhana procedure. You can just give Svedana and you can give a Virechana Aushadha.
So it is true textually. Textual reference is correct. But there are a few things that we may be in a situation where reading in between the lines is necessary. In Charaka Sutrasthana 13th chapter, while mentioning about Snehana Dhyaya, who are all eligible for a large quantity of Snehana? Visha is one such. Out of that context of Prabhuta Snehapana should be given for a Visha patient is Hridayavarana. Again, in another context, Madhyama Matra Snehapana should be given in a case of Visha is mentioned. Who are all eligible for that Madhyama Matra Snehapana? They are Dushi Visha. Why? Because even though in the text it is mentioned that Dushi Visharto Suswinnam, we can convince the children that why Snehapana is not mentioned, because there is an element of Kapavaranatva in that.
Yes.
Kapavrito Varshagananubandhi should be written in the board. Kapavrito Varshagananubandhi Doshi Visharto Suswinnam. That Svedana Karma is not meant for a Shodhana Karma soon after that Shodhana. No. Once we do that breaking of Kapavarana by Svedana Karma, the causative factor is exposed. Once that causative factor is being exposed, for example, an ample amount of kapha is there, and that Kapha is masking the illness. The patient is a diagnosed case of XYZ disorder. May it be any disorder where there is Prabhuta Kapha. Say Grahani. Grahani has an element of Dushi Visha in that because there is a cumulative effect of Ama Visha in that. A classical case of Kapaja Grahani is that Ama Shayaste Kaphavata Rogi line for Dushi Visha. If such case comes to our OP, what we have to do is we have to break Kapha by giving him a Tikshna Ushadi. Or in case of Swedana in the form of Karanjanimba Parisheka or a drug which is Tikshna in nature, Dashamula Kashaya Parisheka. And that Kapha has to be broken. Once that Kapha is broken, the symptoms may be evident. We have to do Amapachana again to conquer that Utklishta Avastha. Then we have to give Snehapana in the line of Sukanta Grita or Kalyanaka Grita or any other Grita. Tiktaka Grita is mentioned because there is a reference of Tiktaka Grita in that context, in the context of Jwara. If we see Punaravartaka Jwara, there is a reference of Tikta Grita Opicha. By Gritapana should be given for Punaravartaka Jwara. There is a shloka for Grahani in that. That's why I directly took that reference from Punaravartaka Jwara. Then we have to treat him with the Snehana, but Snehapana should be not more than Madhyama Matravastha. Then we have to give Vamana or Virechana according to the condition. For Grahani, of course, not Vamana is choice always. We have to opt for Virechana with a drug which is suitable. I cannot tell the prescription because case is not there. If we can show a case, we can tell a specific medicine. But it is not an absolute contraindication of Sneha in Dushi Visha because this is the condition. Again, in Visha or in Mushika Visha, we may need an involvement of Tailapana also.
Okay.
A recurrent case. That also we have done. Tailapana with the Madhuyashti Adi Taila or Balaguduchi Adi Taila. So it is not an absolute contraindication. In the text it is mentioned, that is straight, but reading it in between the lines is in this way.
Okay. Thank you. Is there any question from other delegates? Is there any other questions from other delegates? Okay. Thank you, sir. Thank you for your vast and very informative lecture. Now I request Dr. Shobha Bhatt ma'am for vote of thanks. Over to you, Dr. Shobha Bhatt ma'am.
Thank you, Dr. Ashish. At the outset, I would like to extend a heartfelt thanks to Dr. Gopikrishna for his wonderful lecture. Am I audible, Dr. Ashish?
Yes, ma'am. Audible.
Okay. Thank you so much, Gopi sir. In a short notice, we had requested Gopi sir. We knew that whenever we have Gopi Krishnan sir or Mahesh Savalgimat sir online, we have lots to ask them. We have lots to listen to them and learn from them, irrespective of who is the listener. It was very evident today. So this is just the beginning of such sessions. So I had requested specifically Gopi Krishnan sir that today when we begin, we want you to speak on the theoretical aspect so that all these topics are newly added and it really needs a lot of clarity to teachers also as to what we should teach to the students. Before we teach them, we should know what and all references are available in the classical textbooks. So many of the, we are seeing that every week, every month, we have new textbooks coming in the subject of Agatantra. Now that the new syllabus has also come out, we are expecting lots of textbooks. And it is nice that we are writing textbooks, but we should always have the proper references in the textbooks. That is why Gopikrishna sir is so busy. Though everything is in his mind, maybe writing a textbook would take a lot of time to Gopikrishna sir. But with such a deliberation, maybe today all the teachers have got these references from sir, hand-in references. Searching all such references in the classical textbooks is really a very tedious job. And with such an simplicity, this is the speciality of Gopikrishnan sir. Within 1 hour, he has given us a gist of all the Samhitas, especially Ashtanga, Sushruta, and Charaka Samhita. And if given an opportunity, maybe when we are all striving hard to bring in or set up an OPD for Agatantra everywhere, Krishna sir is ready to take up all the Ashtangas and treat it in Agatantra in his clinical practice. And we are indeed very lucky that we have got to listen to Gopikrishna sir. It is always so encouraging. And very soon, maybe we will expect Gopikrishna sir that you will also enlighten us with your clinical experiences. Today it was for theory, and next time it will be for clinical experiences, wherein all of us, the teachers, can get an idea regarding, especially sir is very famous for practicing Kerliya Vishachikitsa, very small combinations, nice combinations. He practices, he prepares his own medications, he makes people preparing his own medications and uses them in his clinical practice. Maybe some other day we can request sir to share with us certain combination which he uses in clinical practice so that all of us will know, apart from Dushi Vishari or Dashanga or Bilvadi, our list of medicine ends there. We don't further, we cannot move. And today we had a huge list of participants from throughout the country. And it was so nice to see even our teachers present. I wouldn't like to name maybe, but I could see in the list several teachers also who have taught Gopikrishnan sir and many of us here. They were also here with us to listen to him or share their views. And we are extremely thankful from all of us. Thank you, Gopikrishnan sir, for this wonderful lecture. And we expect many more such lectures from you. Thank you, Ashish sir, for it was a last minute, but you conducted this program very well. Thank you very much, sir. And all the participants today also, we had 80 participants to begin with. Right now, though it's 54, it's 8:30, and it's expected that the little people will leave. But then we have huge participations, and it is really nice that all of us are taking interest. One request to all of us is that this recording will be shared. Getting to know this Samhitas is not a joke. So let us listen repeatedly to what Gopikrishnan sir has said with our Samhitas in hand. Let us go back to our Samhitas and listen this and repeatedly see to these Samhitas so that we know these things, we study these things and imprint these things in mind. And people who have an idea to write textbooks, all of them, to all such teachers also, please go and see to these references, original classical references, and try to incorporate these ideas, what sir has said, in your references that you give in your textbooks. With these concluding remarks, I thank each and every one of us present here today, and hopefully we will make this session a very useful, make the best utility of this wonderful session. Thank you once again, Gopikrishna, and thank you one and all.
Thank you, ma'am. Thank you for vote of thanks. Now we'll end the session with Shanti Mantra. Om Dev Shanti Antariksh Dev Shanti Prithvi Shanti Apah Shanti Shanti Roshadayah Shanti Vanaspatayah Shanti Vishwe Devah Shanti Brahma Shanti Sarvam Shanti Shanti Reva Shanti Rama Shanti Rede Om Shanti Shanti Shanti. Thank you, sir. Thank you once again.